Good morning, everyone. I am doing a really exciting procedure today. I am going to treat someone who went for a facelift 6 weeks ago, and I'm going to do microneedling. My name is Desiree Coetzee. I am a micropigmentation specialist and also a paramedical tattooist. So I work on anything from cosmetic, permanent makeup, all the way to scar revision, areolas. Some of my services are covered by medical insurance. So this gentleman is a very good friend of mine, and he recently went with his girlfriend to, I believe it was Serbia, and he decided while he was there to actually get a facelift there. So the facelift turned out wonderfully, and now he wants to come and he wants me to treat him with microneedling. So he has been a very good microneedling client because I've been working on his acne scars. So let me explain to you. You get two kinds, actually you get many kinds of microneedling. When someone had a facelift, you cannot do RF radio frequency heat microneedling on them before a year. So I am not doing that on him. I am going with a regular skin pen and I'm going to do cosmetic microneedling on him. Why am I not doing medical? Because with medical microneedling, you will go in usually at least 2 to 3, sometimes 4. I do not want to make such deep channels in his skin. I do not want to overstimulate the brain because microneedling induces collagen, and I want to go the route that's the safest for him. After a year, I can do radio frequency, and after 6 months, I can do regular medical microneedling. What's the difference? Let me explain. With medical microneedling, you go deeper and you have less needles, anything from 14 to 9, sometimes 6 needles. And that sounds like a contradiction. But let me explain to you, with cosmetic microneedling, we have more needles. The more needles, the less damage. And we're not going that deep. So we're going to go that route today until after 6 weeks he's coming back, and then I will go to lesser needles, and then after another 6 weeks lesser needles, until we reach the point where we can do medical microneedling on him. Number 2, you're gonna love this is a fun gentleman too. When you come for your microneedling procedure, before you come, you cannot participate in any alcohol, any coffee, any green tea, any supplements for at least 24 hours. Those are all blood thinners, and people, green tea definitely have more caffeine than coffee. So be careful. So you all know I have clearless ink, and it's not ink at all. It's a medicinal serum. It's sterile, and I'm going to insert that in his skin. The reason why is I want to make his skin stronger after the surgery, so we can start making it a little thicker and we can actually go deeper and do the medical treatment. I have not seen his scars. I do not know what he looks like at the moment. I've seen pictures. It looks like his plastic surgery was amazing. He looks at least 10 years younger, and I am so excited to show you the procedure. Before I go and do this procedure, I want to just remind you, I have another video where I am doing a treatment for a lady who had botched and older plastic surgery scars. I also have videos where I'm actually doing people's body, the stretch marks. Do go look at that if that's something that interests you. I will try and remember to link it above. And if you have any comments, please mention them down below. I am actually going to step out and ask you for a personal comment. Okay, everyone, have a beautiful day and enjoy this video. Usually when you do microneedling, I only use Dr. Zio products. Because he has medical scars, we are going to use medical products today. I'm using green soap, which they use in the theater to scrub the doctors, and I'm using a disinfectant. Now, I do not want to use on his skin and dry it out. I do not want to use alcohol. So I'm using witch hazel. When you buy the witch hazel, make sure it's hexane free. So we're going to clean his skin with the witch hazel just because we still need to numb him. He really needs a massage. He honestly does need a massage. We're going to clean here. I will go with a different needle over these scars, though his doctor did a great job. And if he follow instructions, the scars should heal nicely. So I'm getting more cotton. I am going to use not new conceal. I'm going to use Formula 3 of Artemis. This is a scar revision product. And Artemis, you're welcome to send me commission for promoting you. The reason I choose this one is because this is a clearless serum and I want to insert this in him because this is gonna actually assist with his healing and take away those scars completely. Do not use this on other clients. When you use it on one client, you cannot use it on another. I'm gonna open up his pores. He's still most probably very numb from his surgery, and this guy never shaves when he comes to me. This is a wonderful friend and he's a good man, but he always comes to me by the end of the day and then their hair has grown, which is so funny. Okay, so I have now opened his pores. So put the numbing on your glove because you are trying not to contaminate. So I'm using a numbing only lidocaine. I'm not using epinephrine because epinephrine, it's going to cause the blood veins to restrict, and what's going to happen is that we're not going to be able to get that very good serum into him, and you need the blood veins to actually move the serum into his system. So what we do usually is we send them for a lymphatic drainage massage. When you see him in a few months, you will see that all this is going to be gone. What I would advise him to do is to try and sit and sleep. He should try to not sleep. Did they do a mouth lift too? So the mouth is still a little pulled. What I'm going to do is I'm going to numb his lips too, and I'm going to put some serum in there too to fill this lip up, because what happened here with the pull, I'm going to put some on the top lip, and you'll see I'm going to put some serum in this just to plump that up again. Okay, so there we go. Now we are going to protect this, and he can be on his phone because now he's gonna wait for a while to numb. And I don't know why this one just opens, so his eyes are open. Okay, and I'm gonna set it on about 10 minutes, especially under this eye. I am using ice cream. Hello, Tina. I'm using ice cream on him. The reason I am is because ice cream contains a hemorrhoid cream, and hemorrhoid cream will get rid of the water retention because that's what it does with hemorrhoids. However, this is FDA cleared and approved recently, and there's lidocaine with this, there's other products. So please do not go buy hemorrhoid cream and put it all over your face. But this one we're going to use today on him, specifically on the areas where I see swelling. If your eyes start tearing, it's okay. So we know that he's fine. We know this is actually going to help him and assist him. So they didn't put the kind in that self-dissolve?
Yeah, some did, but behind the air day were the kind we had to take out.
You can see this machine is on Derma, and I'm using the clearless serum. And we're going to go into the stitches now. Tell me if it's painful.
No.
It's going to bleed.
That's fine.
But it's actually good if it bleeds because the blood also helps the healing. Now we're going to do the other side. So I'm going to put some liquid Band-Aid only on these because I don't want, he's supposed to not shower for 24 hours after you do medical scar revision, but he's obviously going to take a bath and a shower. But this is going to be a little red, and then in 48 hours it will be much better. Seroma is when you have some retention. It's basically fluids that build up. The lips are very sensitive, so we're just relaxing here because this side is somehow thinner. So I'm giving him some feeding there. I'm gonna put this over him. You see how white he is? He's really numb. I'm just gonna put it all over him, this, and then I'm gonna start microneedling it in, and this should really help him today. Okay, so I'm gonna do the biopen on him. I'm gonna put it actually maybe too deep. Usually I would not do it so deep. I'm gonna put it on about about 1. Usually I go all the way to 3, but I'm going to start on 1 and see how his skin react, because you guys can see all the swelling here from the lymphatic lymph it's just clogged. And we're going to start. So when you do microneedling, you will use hyaluronic acid, and I'm using first this component because I don't want to put too much liquid basically in his skin. However, he must drink more water, because the more water he drinks, the quicker it's gonna dissolve and the lymph will carry it out through the kidneys. Or even beer. This is one of the times when beer is good. So I have the red light because the red light heals. And today I'm gonna start under the eyes, because that's where the most swelling is. But look at these labia folds. They're almost all gone. This guy is going to look at least 10 years younger soon. So with this needle, I have here a 14 needle, and I am causing very small micro channels, and I'm inserting the Artemis serum, which I already did on his scars. You would go over it at least 4 times. In his case, I'm going to do more than 4 times. And I'm actually going to push up my needles to, I'm going to do 1.5 on him. I just saw his skin can take it. So why I'm actually doing this is, after microneedling, your skin is for a little while really tight, and it almost dries it out because the moisture in the skin basically evaporates almost. This is going to be good for him. He wants his skin tight, because when the skin is tight, it's most probably going to pull the lymphatic drainage where it should go.
Okay, this is our client. We're just going to ask him about his facelift process and his experience in microneedling. Should I re-say that?
Hi, I've been a client of Desiree now for a little while. It's been doing really good on my skin. A lot of the scars have been, diminished. But due to the age, and my skin has started sagging, some of his face in older years. So I went to my girlfriend's country in Serbia, where they do a lot of facelifts, and they're known to do a very good job. So I had it done on September 4th, and I'm satisfied with the results so far. It's still healing, because it's a complete healing process, 6 months to a year. But right now I'm using the microneedling to help diminish a few scars that are from the procedure. And I can see the appearance. The doctor told me it'd take about 12 to 14 years appearance off my skin. I see it already. And once Desiree finishes her little magic touch, well, it should be a nice process. There's not much pain at all, to be honest. She takes care and puts the numbing cream. But as I read and researched the microneedling, it's designed to create a healing process on the skin, because your body naturally heals itself. So you got to stress it, and it cause a little injury, and then it causes it to replenish and produce new cells, and gives that youthful appearance.
Wonderful. Look here. Can you see how it's already lower? Okay, you know why? Because I put little teeny tiny channels in his skin here, and it's already evaporating. If you go back on the video, you'll see it was much higher. So this most probably will work. His skin is going to be very tight tomorrow. Whenever you do the forehead, you do not go in deeper than 0.25 or 0.5. And the reason why is because this is bone. And if you go deeper, you can damage the skull underneath, basically. Now here you can go a little thicker, but here you never do it. And for this, I'm going to use hyaluronic acid, because he doesn't need any of that special treatment on this. The best treatment for wrinkles, the very best treatment, is it's Botox or a facelift. And sometimes radio frequency treatment can also help wrinkles. You see his eyelids, and your eyelids interferes with your driving. They call it your peripheral view. Then if you have certain medical insurance, eye ophthalmology insurance, they will pay it out for you, the medically, a certain percentage. So this I had exactly the same years ago because I went to my ophthalmologist. He tested my eyesight and he told me that I need to go do it for my peripheral view. And I did not even have that much because I was still very young. Okay, I'm changing machines. Look how he's bleeding, you see? Okay, I'm going to turn this off and I'm going to go back in with this serum because I want to fix those scars for him. Though I can assure you guys that if there are scars that become nothing, it's these tiny scars. These scars always heal the best. So to him today, he's scared I'm going to go inside his eyes. It's a good thing he's a man, because if he was a woman coming for permanent makeup, he will not make it. So I hope that you as the viewer can actually see that he already looks thinner. Face already looks skinnier and more heart-shaped. So this definitely helped, and hopefully he will see the complete result within 7 days. This is expensive stuff, but this helped him. So Artemis, thank you for reaching out to me. I will definitely purchase more from your company. So how was your trip overseas?
It was really good.